Hey everyone, welcome back to Shock Doc Medical. I'm Dr. Rod, and today, oh man, do I have something cool to share with you. Have you ever wondered how we can take those mysterious skin rashes and turn them into a roadmap for better treatment? What if I told you that there's a whole world of objective tools that can help doctors not just see, but actually measure the severity of skin conditions like psoriasis, eczema, lupus, and even life-threatening situations like toxic epidermal necrolysis. Buckle up, because today we're breaking it all down. Let's kick things off by talking about why objectively assessing the severity of a rash is so crucial. Picture this. You walk into a clinic with an inflammatory skin condition. Maybe it's psoriasis or atopic eczema. And instead of just eyeballing it, the clinician uses a validated scoring system to actually measure the extent and severity of your skin involvement. This isn't just for kicks. It's essential when new therapies are being introduced so that doctors have solid, measurable data to work with. Now, one common method that gets tossed around is calculating the percentage of body surface area, or BSA, that's affected. But here's the thing. While BSA tells you how much of the skin is involved, it doesn't really give you the full picture of how severe the condition is. That's where these clinical scoring systems come into play. Let me run through some of the heavy hitters in the world of dermatology scoring systems. First up is the Psoriasis Area and Severity Index, or PASI. If you're dealing with psoriasis, PASI is one of the best-known disease-specific tools out there. It gives clinicians a structured way to assess the severity of inflammation, scaling, and redness in psoriasis. Now, while the article I'm commenting on today doesn't dive into treatment meds or specific doses, knowing your PASI score can help tailor therapy precisely. Next, for our friends dealing with atopic eczema, there are a couple of scores to know about: SCORAD and EASI. These tools help gauge the severity of eczema, considering factors like the extent of the rash and the intensity of symptoms. It's all about giving both the clinician and the patient a clear snapshot of what's going on. Ever heard of CLASI and DSSI? Those acronyms might sound like secret codes, but they're super important. CLASI stands for the Cutaneous Lupus Disease Activity and Severity Index, and DSSI is the Dermatomyositis Skin Severity Index. Both of these have been validated by dermatologists and rheumatologists, and the cool thing is they correlate really well with changes in global assessments and even specific symptoms like pain and itch. So if you're a doctor trying to track a patient's progress, these tools are pure gold. And then we have something a bit more critical: the Scorten score. Now, this isn't just your everyday rash score. Scorten is a severity of illness score developed specifically to predict mortality in cases of toxic epidermal necrolysis, or TEN, which is essentially a form of Stevens-Johnson syndrome. When things get really serious, having an objective score like Scorten can be a lifesaver, literally guiding doctors on just how aggressive the treatment needs to be. But wait, there's more. Let's not forget the basics: calculating the body surface area, BSA, affected by the rash. The classic method here is the rule of nines, a technique originally devised for burn patients but super useful in dermatology as well. Here's how it breaks down for adults. Head and neck, that's 9%. Anterior chest, 9%. Posterior chest, another 9%. Anterior abdomen, 9%. Posterior back and buttocks, yep, 9% again. Each upper limb gets 9%, and the lower limbs, they clock in at 18% each. Finally, the perineum is just 1%. Now, if that seems a bit abstract, here's a neat trick. You can use the patient's palm as a measuring tool. The palm, without fingers, is about 0.5% of the total BSA. If you include the fingers and thumb, that's roughly 1%, though this method is considered less reliable than just using the palm alone. It's a quick, on-the-spot way to get an estimate, especially in busy clinical settings. Now, why is all this important? For clinicians, these objective scoring systems aren't just academic exercises. They provide a framework to assess how much a condition is affecting a patient's life, often supplemented by tools like the Dermatology Life Quality Index, DLQI, which taps into the patient's personal experience of their condition. This dual approach, combining clinical objectivity with personal impact, is what makes modern dermatology so advanced and patient-centered. Imagine being a patient who's been struggling with a severe rash. Instead of vague assessments, your doctor has concrete numbers that show improvements or worsening over time. And for us doctors, it means we can tweak treatments more precisely. While today's discussion is focused on these assessment tools rather than specific treatments, knowing these scores can influence decisions, like whether to use topical steroids, calcineurin inhibitors, or even systemic therapies. And yes, if we ever dive into treatment details, I promise to give you the full breakdown, including medications and doses. But for now, let's stick to the diagnostic side of things. So, what do you all think? Have you ever seen these scoring systems in action in your practice? Or maybe as a patient? How did it change the game for you? I'd love to hear your thoughts. So drop a comment or shoot me a message on our community page. To sum it all up, today we've explored how objective tools like PASI, SCORAD, EASI, CLASI, DSSI, and Scorten are revolutionizing the way we assess inflammatory skin conditions. We broke down the rule of nines for calculating BSA and highlighted how these methods, combined with patient-reported outcomes like the DLQI, are key to tailoring treatments and monitoring progress. It's a fantastic reminder that medicine isn't just about treating symptoms. It's about understanding and measuring the whole picture to deliver better care. If you found today's deep dive insightful, make sure you hit that like button, subscribe to Shock Doc Medical, and share this episode with your friends and colleagues. Let's spread the word on how these diagnostic tools are setting the stage for improved patient outcomes. And hey, if you have any questions or topics you want me to cover, leave a comment below. I'm all ears. Next week, we're diving into another groundbreaking discovery in the medical field that might just change the way we approach treatment altogether. Trust me, you won't want to miss it. Until next time, stay curious, stay informed, and keep pushing the boundaries of what's possible in medicine. This is Dr. Rod signing off from Shock Doc Medical. Catch you later.